Welcome all. Welcome to this AimExcellence NRMT question answer discussion. In this particular discussion, there is one important aspect. This is a JQA plus question, but with JBM. It is journal based MCQ. In the recent examination, in the Central Institute examination, we have seen that the questions are actually picked up from the journal publication itself. So Pappu, a 9-year-old child from family of 5 siblings residing in colony with past history of pruritus in perianal skin and insomnia and presented with pain, nausea, vomiting and fever, and upon coughing, pain at McBurney's point. Treatment you will suggest. So this particular trunk of the question is actually pointing towards a case of appendicitis. It is pointing towards a case of appendicitis. What is important here, we are finding one important finding, that is the appendicular lumen is actually obstructed by a parasite. This is Enterobius vermicularis. Enterobius vermicularis. This is actually obstructing the appendicular lumen, stopping the lymphatic flow, eventually causing infection and necrotic changes and leading to the appendicitis. So there can be also neutrophil infiltration out here. So this is a case of appendicitis. What is different out here? This is a Pappu 9-year-old child. The appendicitis present due to the parasitic infestation is actually common in the 7 to 11 year age group, means childs. In US, it is actually present across the strata. It is present across the strata, not limited to the low socioeconomic class. But here in this question we have given the 5 siblings and residing in a colony, which is actually in consonant with the low socioeconomic class. The presentation that have been given out here, the pruritus ani and insomnia and the restlessness that is going to be seen in a child, that is actually suggesting towards a parasitic infestation. Then there are the classical findings. There is the classical finding like pain, nausea, vomiting and fever. Upon coughing, pain at McBurney's point, that is Dunphy sign. These are in consonant to the finding of appendicitis. So we understood by now from the case, the trunk of the question, and also the finding in this histopathology picture. This is a case of appendicitis due to the infestation of a parasite. We all know appendicitis is the most common surgical emergency worldwide. Most common surgical emergency worldwide. And Enterobius vermicularis is the most common parasite, though it's not a common finding, but among the parasites, this is the most common parasite associated with the appendicitis. Also the Ascaris lumbricoides and others are there, but Enterobius vermicularis is the most common finding. So in this particular case, we understood there are findings that is pointing towards a parasitic infestation in a low socio-economic class family, and also this is a case of appendicitis. So what we will do, we can leave this patient with the appendectomy only, or appendectomy with a discharge with albendazole 400 mg, or can repeat the dose 2 weeks later, or can do a cellular step technique in all the siblings. As because this is low socio-economic class family and only 40% of the cases are going to present with the classical presentation like in this case. So we will do the cellular low step technique to find out whether there are parasitic eggs, enterobius vermicularis eggs are there or not. In that case, if there is finding pointing towards appendicitis, we'll do the appendectomy, or in case there is presence of the eggs but without any finding pointing towards appendectomy, we will give the albendazole to eliminate the infestation. Hope you like this particular presentation. This is actually picked up from the surgery journal and which is being recently published in 2016. If you like our presentation, continue to be with us in the Facebook, Twitter and YouTube. You can understand from this particular presentation how a known topic, the answer can be changed if there is a special manifestation, special information being there in the question which is pointing towards a particular case, and that has happened in recent examinations. That can also happen in the winter examination too. If you like our presentation, be with us, because AimExcellence never let down their supporters. AimExcellence actually cherish and always thankful to the people who trusted the presentations and every time trying to give better offering to them. Thank you for being with us. Thank you for supporting us. Really, really thank you.